Okay. Okay. All right, good evening, everyone. I'm Sandro Tejada, Director of Major Gifts and the Seton Hall Parents Program. Thank you for joining Seton Hall Week in our virtual offering, How I Got Here, discussion with Seton Hall parent Michael Smith. This session is being recorded. Just wanted to give you a heads up. We will have an on-demand page and we'll add all our Seton Hall Week recorded sessions to the page. Please kindly mute yourself if you haven't. And if you have any questions during this session, please use the raise your hand icon on the top right of your screen. Please use the chat feature to share your questions, or you can hold your questions until our Q&A session. And as you probably know by now, Seton Hall Weekend is Seton Hall Week this year. And while this year's event will look much different than it has in past years, we are committed to provide a week-long experience full of engaging virtual offerings for families, alumni, students, and the community. Now, the How I Got Here discussions provide students and our Seton Hall community the opportunity to get a firsthand perspective about the careers enjoyed by Seton Hall parents. And I'm honored to have the privilege to introduce our guest speaker, Professor Michael Smith. Michael joined the faculty team in 2020 as the Associate Director of Clinical Education at Boston University Physician Assistant Program. Before becoming a PA, Professor Smith worked as a paramedic in urban communities in the greater Boston area. He is a graduate of the University of Massachusetts and received his MS in Physician Assistant Studies from Northeastern University. He previously worked at Marist and PA programs and joined Boston University with over 5 years of experience in PA education. Professor Smith practiced clinically in orthopedics. Michael, it's your turn to present. Thank you so much for being with us.
Thank you very much for having me, Mr. Tejada.
You're welcome.
Thank you for that warm introduction. So when I first saw this, the email about the opportunity for parents to share their stories, how I got here, I said, well, I think I have a kind of an interesting story. Certainly my path to BU is not a quite direct one. Some would even say maybe meandering, but in any case, as Sandra Tejada said, my name is Michael Smith. I'm Associate Director for Clinical Education at the PA program at Boston University School of Medicine. We'll start at high school, where a lot of the students I know, some of the current students in the undergrad students may have questions about the PA program and what a PA is, and how I started out and how they could start out. I myself grew up just north of Boston in a town called Malden. It's working class. I always described it as working class poor neighborhood. So I grew up in the greater Boston area, but was not a Sox fan ever. I spent the last 23 years living in southern New Hampshire, just over the border. I graduated from a public high school, Malden Public High School, which incidentally in 2013 was named as the most diverse public high school in the Commonwealth of Massachusetts. So I knew it when growing up that we just, it was a melting pot, and we were all kind of working poor. I went into Northeastern University. I thought I was going to be a lawyer or get into law enforcement. So I was a criminal justice major at Northeastern initially. And I was the first generation college student, though we didn't call it that back then. We just said I was the first one ever in my family, both sides of my family, to go to college. So there wasn't a lot of, I know for my kids, my wife and I helped guide them and kind of get them towards college. It wasn't that way for me so much. It was a different era. But I'm a first gen, and I kind of relate to the first gens who come through my program. I first moved to New York City in 1984, just initially to work with a co-op. through the criminal justice major through Northeastern University. I worked for the DEA, the Drug Enforcement Administration. That on the right-hand corner is what my view from when I would walk on that side of Brooklyn was of Lower Manhattan. I became a Yankee fan because of Don Mattingly and Dave Winfield, and basically the picture on the right is the 18th Ave train station. If any of you are from Brooklyn, that's in Bensonhurst, 18th Ave. That's my younger son back in, I think that's 2011. Unfortunately, coming from a poorer family and not having the guidance, not having the wherewithal to stay in college, I just dropped out because I didn't have any money and I really didn't know what to do. So I dropped out of college. I just kind of meandered, took odd jobs, didn't know what I really wanted to do. I say to students now, when you're 18, 19 years old, it's really hard to know what you're going to do for the rest of your life. And I look back at my experience and realize what I thought was meandering and couldn't decide on something was I just hadn't decided on what my career was going to be. So I just worked various jobs. At least I still worked. I was a printing company and a bindery. I was a courier bringing packages certain areas and assistant manager in retail. Finally, in '87, I had scrounged up enough money, so I went back to college, only switched majors to political science. That is a picture of UMass Boston under construction. And I finally did get my MBA. Again, had to take more time because of money. Finally got it in 1994. But basically, one could say I was drifted and aimless. I'll spare you the how it happened, but I became an EMT and thought it'd be kind of a cool thing to do and, help people. Once I went into medicine, I found my calling in life. It was medicine. And from then on, it has been just an upward trajectory because I finally knew what I loved. And coincidentally, I actually met my wife on the ambulance as well. We were both EMTs. EMT after 1 year became a paramedic in 1994. I worked in the greater Boston areas, if you know the area, like Somerville, Everett, Chelsea, urban areas, right around where I had grown up. So very busy paramedic. I was fortunate enough when I did my training to train with New York EMS for a few weeks, and just incredible. That picture of me on the New York EMS ambulance is from 1994, and coincidentally, I was actually able to work my first week and a half out of Coney Island, where kind of the area where I had lived in Bensonhurst. So it was really neat. Of course, I just missed the Rangers by a week. I always tell my sons. Other good things that happened was I married my wife, who I met on the ambulance, and we decided to settle down. We just actually had 25 years of marriage. My son Nathan was born in 1998, and my younger son Daniel was born in 2001. After being a paramedic for about 6 years, I was ready for more. And I said, you know what, I want to have you more responsibility. So I joined the Northeastern University PA program and got myself back to Northeastern. I graduated in 2001. And then for the next 13 years, I worked as a busy orthopedic surgery PA, a physician assistant. And that's me in the middle with the spacesuits, we call them, when you do a total joint. That's a total knee replacement we're doing right there. I'm on the other side. On the left, on the right of that picture is the surgeon on my left. And so I would be essentially the assistant surgeon during the case. It's incredibly exciting. A lot of different things. I switched over to the walk-in injury clinic in 2014 because I just was tired of being on call. And then I said, you know what, the next transition would be to teach because I've taken students as a preceptor and I've done this, being the next logical step. Also, my wife is an emergency medicine PA, and that's a picture of her in her now, that was at the height of the pandemic when she would go into the emergency room. She is in Nashua, New Hampshire, the larger city in New Hampshire. She works in basically the city hospital there, Southern Hampshire Medical Center, in the emergency department. For the last 5 years, again, like I said, I transitioned into education just because I figured I didn't want to be on call anymore. I had all this experience. Absolutely loved it. For a kid who grew up aimless, had no idea, to settle, to see where I am right now and to have found what I absolutely love. I consider myself very lucky. So 2015, I started working at Mass College of Pharmacy and Health Sciences in Boston. I did that for 4 years, and nobody was leaving or dying, so I wasn't going to move up. And I said, well, if I want to be a program director, a director of a physician assistant program, I need to get experience on the clinical side. So I went to Marist College in Poughkeepsie, and then COVID hit, and they sent us all home. And I said, I need to be home. What am I doing? I need to go home and be with my family. As luck would have it, Boston University, who I had interviewed with a couple of years ago, came in second to some of the research. They called me and said, we have a position. And it was right now a match made in heaven. So I'm now the Director of Clinical Education, sorry, I put medicine, since September 20th, and that's where I am now at Boston University. So for those of you, like particularly the undergrads, who might be saying, well, what's a PA, a physician assistant? Physician assistant's a nationally certified, state licensed, advanced practice medical professional. We work under the license of an attending physician and with the rest of the team as part of a medical team. We work with pharmacists, nurses, physical therapists, occupational therapists, dietitians. So we practice in all 50 states, including the territories. We prescribe medicines. I diagnose. The next slide will get into it a little bit more. And also PAs in the military, which is probably the largest employer of PAs. They practice the same. Their standard of care, their scope of practice is the same whether based in Germany, Japan, Korea, or Afghanistan. What can we do? We take medical histories, conduct physical exams. I diagnose and treat illnesses. In fact, my part-time job, I work on site by myself. I do have a physician oversight that's available by telephone, but basically I'm the provider there in our walk-in injury clinic when I work. We can order and interpret lab tests and imaging studies. We develop treatment plans, counsel on preventative care. A lot of PAs still work in primary care, so that's a lot of the duties they do. For me, I assisted in surgery, and being in Southern New Hampshire in a not a remoter area, but a more rural or suburban area, physician assistants really do function like a fellow or an assistant surgeon. Write prescriptions, just like any other advanced practice provider. I make rounds in hospitals and nursing homes. Specifically, what you do depends on what your attending's board certification is in and your level of competence. How are we educated? Most PAs, about 26 months. A lot of the programs require the same prerequisite courses, your anatomy, physiology, biology, organic chemistry, and all with labs that the medical schools do. First year in general is all classroom training, what we call the didactic year. Then the second year is when you start your clinical rotations. You take all your knowledge and then you go into clinical rotations, either 5 weeks, 6 weeks, BU is 4 weeks, and you go to a pediatrician's office and you learn pediatrics that month. And then the next month you could be doing women's health, the next month general surgery. So about 2,000 hours in clinical rotations, which is about a year. And these are some of the core rotations you have to have: family medicine, internal emergency medicine, general surgery, as I'd mentioned. So that is a year-long process in of itself, how you learn to be a PA in the hospital and in the clinic. How many are there? There's over 125,000 certified PAs in the US right now. Typically, they see about 3,500 a year. I don't. We're a slower clinic, but when I was, and it also will depend whether you do urgent care versus surgery. The median salary up in Massachusetts, about 100,000. Specialties, cardiothoracic surgery, orthopedic surgery, things like that, tend to pay more. There's over 260 PA programs operating nationwide. Again, a lot of them want prior healthcare experience. Boston University doesn't require it, but we certainly look on it because it does. If I look at an applicant who has been a nursing assistant for 2 years, I know that person understands how to take care of people and what it means to from the ground up. So I look at that with favorably. Specifically, a little word on the BU PA program. The PA program with us, it's a 28-month program. Again, the first 12 months are in the classroom didactic section. The next, which is where I'm more in the clinical phase, begins in the second year. It's 16 months. There's 9 core 4-week rotations. Then we offer them 5 different electives. Students are not required to go find their own rotations. The core rotations the school provides. And also we're up in Boston, we're associated with the Boston Medical Center. So we have so many different areas where a student could say, hey, I'm actually really interested in doing PD oncology for some reason. We have slots like that open, or we have a spot up in Maine. We have things like that they could do as electives. And then there's 2 months where we have a researcher on our staff that works with them to get their graduate thesis, to prepare it and publish it. And that's the BU. When I put the website up there, the general website, and certainly you can find me in there as well. Sorry if I spoke fast. I didn't want to take up too much time on the presentation. So, and thank you. This is a picture of one of the other nice things about being a PA, and I have to mention this. This was taken in 2013 at Dodger Stadium, and hopefully the Dodgers will close it out tonight. My wife is also emergency medicine, as I said, she's a PA, so you have to keep up a certain amount of continuing medical education per year, per 2 years when you renew your license as a PA. So most employers give you a stipend to go somewhere and go to the class. So what my wife and I have done is we've combined our stipends and taken big family trips. So we would, instead of just paying vacation money, we would go to the class. Like this one was my medical conference. And I was in class from 8 a.m. till noontime, and then the rest of the time is free. So you get together with your family. There's a stipend that you're given that helps offset the costs. So altogether, by my wife and I both doing that and pooling our resources, our CME money that our employers get us, we've been to 22 major league stadiums so far. And that was by Dodger Stadium is by far one of my more favorites. So Yankee fans by heart, but we've been to 22 as a result of what we do, and I love it. And I'm happy to answer any questions from here on in.
Professor Smith, Sandro, there is a question in the chat, and it's a question from Ahmad. He asks, which one do you believe is more competitive, medicine or physician's assistant?
It depends on the person. That's a good question. So they're both competitive. I would say one of my attendings once told me that the hardest thing to do is to get into medical school. And the second hardest thing to do is to get kicked out of medical school. So they're very competitive, and the same for us. We are actually right now in the middle of applying to going through our application process. Last year, we had 2,300 applicants for 30 slots, and we have about 30. That would be the max that we take this year. And we anticipate about 2,400 applicants applying altogether by the time it's all done to our program. So competitive, it's hard to say. I know that people choose the PA career for different reasons. It's a different lifestyle. So when we get board certified, I'm boarded certified in medicine. I don't have a particular orthopedic surgery board. So one of the things that attracts people to the PA program is, one, the less education. So you have a 4-year undergrad and then a 2-year graduate program, whereas medical school is 4 years undergrad, 4-year medical school, and then usually a 2 to 3 year residency. But PAs can move about. So if I was in orthopedic surgery for 10 years and then said, I don't want to look at another x-ray for the rest of my life, I want to do pediatrics, I could go and be a pediatric PA. Someone would hire me, know that it would take a little training to get me up to speed, but there's no prohibition from me on my boards from just moving over. So they're different lifestyles and they're different course loads. I would say, having seen what my what my attending physicians have gone through, their the course through medical school is just different. It's at a higher level. It really is. One of the things that PAs do is they extend the practice of the physician. So for me, I have these orthopedic surgeons who have worked and done their fellowship and devoted years to orthopedics, but I have all the other medical training that can help supplement our practice. So I hope that answers the question.
Namad has a follow-up question to his first question. He says, a friend told me about a PA who does house calls and introduces themselves as doctor. My friend showed me this video, so I said to her that the PA probably has a doctorate. My friend assured me that this was not the case. What do you think the PA board would do in this situation?
I would tell you that that person did not graduate from any program that I have ever been associated with, because that is verboten. We make sure that we identify ourselves as physician assistants. In fact, when I interview people, if I ever hear someone say, well, I couldn't get into medical school, so I want to go to PA school, I say to the person, why don't you rethink what you're doing? Because being a PA is not a fallback. It's a different career path. It's not, well, I wasn't good enough to be a doctor. There's plenty of people who, and I see all 30 of them that are in my program right now that could easily have gone to medical school. So we do not identify ourselves as physicians. We're very sensitive to that. So if that PA did that, that person shouldn't have done that. And no, the PA boards would not be happy. They would be about a little bit sterner reaction than I just had.
Right. Thank you. This is a question from Jill Patel. After becoming a physician's assistant, how do you specialize in surgery? Is there a fellowship?
Great question. So one of the things that has happened over the last like 10 or 15 years is that some schools have started developing a residency for certain fields, pediatrics, surgery, orthopedic surgery, emergency medicine. So you don't have to do a quote residency or a fellowship. What happens in most PAs, like me, you can use me as an example. You get your undergrad, then you go to a PA program, 2-year PA program. You sit for your boards, and now you're a PA. But you've been trained in so many different things: surgery, pediatrics, women's health. And I gravitated towards orthopedic surgery because of the lifestyle and my personality. So I was hired by a group that knew, hey, we're going to hire this new grad, but he's got all this is good stuff. We can train him to be an orthopedic PA. So if an employer, a medical practice, a hospital that hires a new PA understands that the first year, in a sense, is like a residency. It's you get the PA up to speed to be an effective member of the team. But that's the case in a lot of things. But there's the fellowship itself not necessary. Some places are offering them because they tell PAs, hey, you can do this, and it really sets you apart. I don't know a single PA who ever was harmed by not doing a residency. Right now with COVID, some recent grads looked at it and said, I'd be better off doing a residency because I know I want to do orthopedic surgery. And I can't find a job right now because there's been so many layoffs because of COVID. That might be a case where just now it might be a good idea to do it. But in general, it's not necessary. It would depend on the person. But my downside, my retort is always, if you're going to do one more year of schooling, why didn't you just go to medical school? So.
Yeah, great answer. Thank you. There's another question from Kate Fontes. And how do you recommend we ask to shadow? Good question.
So good question. Right now, and you said it was Kate? So it's a good question. Right now is tough because I don't know anybody who is saying, yeah, hey, come and shadow. In fact, everything I'm reading, I've just read over 150 CASPA applications for our program. And we have a section saying, how have you been affected by COVID? and almost all of them, I was going to shadow Mike Smith at Access Sports Medicine, and shadowing has all stopped because social distancing rules, PPE. We just don't have enough PPE. We can't have that many people in the room. So this is a tough time to shadow right now. When things settle down, the way to do it is to reach out to PAs you might know. Reach out to, if in your medical practice, wherever your primary care physician is, ask the PA there. There's 125,000 out there, so there should be somebody. Or you could also do what some students had done. You could call a local PA program. I know my colleagues would be losing their minds if they heard me say this, and say, hey, I'm in the area. I don't know anything. Do you know any particular, any potential PAs who would allow a shadow? Again, right now it's tough. I don't know a single PA who would allow a shadow. I don't. And my wife in the emergency department doesn't. So, but once things settle down, reach out to PAs and try and ask them. Most PAs are more than willing to share the career.
Thank you. This is a question from Aiden Casio. Due to the pandemic and the limitations in hospitals and clinics, what would you recommend for us to do when looking for shadowing opportunities? And you kind of touched a little bit on
this. So right now, what I would do is, Aiden, are you currently an undergrad?
Yes, I am.
Okay, so it depends on how much time you have left. If you have 2 years, 3 years, there's no rush right now to shadow. What I would do is make sure your grades are as good as they can be. So if some of your grades, your STEM, your science, technology, engineering, math, some of your STEM classes haven't been perhaps as high as you'd like them, retake them. So maximize that. Take this time now where you're not able to shadow. Maximize your grades. Also, find a job. So this is how I look at it. I always joke that I saw the movie Sully too, but doesn't mean I know how to fly a plane. I don't think shadowing someone and me telling you what I do is going to teach you how I do it. It might show you the lifestyle. Hey, he comes in here. You can't leave the operating room until everything is done. So you can learn things about how each PA approaches the day, what they think of their career. But you can't learn how to take care of patients by watching someone else take care of patients. So I would recommend be a medical assistant, be an EMT, be a nursing assistant, be a home health aide, someone who takes care of real people. Because if you're applying to PA school and you've never taken a blood pressure, there's people like me sitting on the other side of the table. And I was 6 years in busy urban areas before I applied to PA school. And there's someone looking at it going, if you've got a 392, but you've never taken a blood pressure, are you sure you really want to take care of people? People are cranky. People sometimes can smell. People can be demanding. It takes so much out of it. It's a wonderful career. I mean, I don't want to sound too gush over it, but it's an honorable career, which humbles you. But people can be demanding. So you have to do something. You've got to start at the bottom and make sure this is what you want to do because it's so rewarding. I can't tell you what it feels like to see the trust on a parent's face when I tell them about, hey, this is what's going on with your child, and this is what we're going to do, and this is how it's going to heal. And it's humbling. It really is. I've had to deliver horrendous news to people. I've seen awful things. So spend your time now doing that. Sorry for the long-winded answer.
Great answer. There's a question from Angelica Sammy. I've heard that there are speculations of changing the name physician assistant to something else. Do you think that will happen?
No. Great question, Angelica. The reason I smile is not at your question. The question is a good one. There's 125,000 PAs in the United States. Not every PA is happy to be a PA. So since I've started, and I started looking into be a PA in 19 or earlier, and again, my wife was in PA school when we met. So I have heard this since the early 90s. Oh, we're going to change the name. We're going to change the name. In fact, about 5 or 6 years ago, a bunch of vocal PAs in the national organization that we have, they wanted to change the name just to PA. So not even physician assistant, PA. That's all we're gonna be PA. And I'm like, this isn't KFC. This is a medical profession. If you don't like being a PA, if you feel that being a PA is an inferior position or subordinate position, do something else. So I know a lot of PAs, and most of them feel like I do. There's always a vocal group that is a small minority that is unhappy with what we're called. I just, they'll always be there, but I don't see it happening because there's enough people like me that just, we're happy with it. Just leave it alone. A rose by any other name is still a rose. But good question.
Yeah, good question. Another question from Ahmad. Did you ever regret not choosing medicine, or did you never think about it?
No, I never did. That's a great question. And again, that gets to the heart of the personality of the person. And which is why I really recommend you guys, if you're thinking about doing it, if you're thinking about a career in medicine as a doctor, as a nurse practitioner, as a PA, start at the bottom. Start at the bottom so that medicine is what you want. So I had started as an EMT, doing transfers, bringing people to dialysis, bringing people out of the hospital. Then I got to be a paramedic, worked in urban areas, and did a lot of 911 stuff. And not all of it is glamorous, I promise you. So then 2 years of schooling, and I'm at a position, I absolutely love what I do, not only just the teaching part, because I do that I love, but where I am in my group, I work with an excellent group of surgeons who you work with. So I remember one time in one of my other attendings, when I did mostly total joint replacement, it was such a great time, such a team effort. And again, I would say to him, this much orthopedics, and I'll never know that much, but I know this, and this is what I help, and it's a great team. So me personally, no, I never did. It would have taken 4 more years. It would have taken so much more of a tax on my family, and that's part of the reason why I left the full-time orthopedic surgery anyway, is because I actually like my wife and I like my kids. I joked that I wanted to pick my kids out of a lineup. So I didn't want to do the call. I didn't want to do the hours that the doctors do. I wanted to be with my family. So again, work-life balance. And it has worked out well for me.
Perfect. This is a question from Michaela Rogowski, and I apologize if I'm butchering your name. She asks, during the pandemic, how can we acquire hours for PA school given the current situation?
So good question. Again, let me assure you, not every PA program requires clinical hours. Not everyone does. It's looked on favorably, obviously. But again, we know this is a different time right now. I promise you, there are still places to become an EMT. There are still, there's volunteer ambulance companies out there. Is it Michaela? Where are you from? An urban area or a rural area?
I'm from a semi-urban area. Like, it's kind of like a city-ish.
Mm-hmm. So there'll be private ambulance companies where you can start as an EMT, and it's sometimes a lot of more just transfer work. But I promise you'll learn stuff. You'll get, being my first year as an EMT, doing transfers into hospital and transfers and stuff, I used that as an opportunity to become very familiar with medicines. I would know, you see certain things, hey, this medicine here, digoxin. People on digoxin have atrial fibrillation, and then you learn more and more. So there's always something good that comes out of it. So if you can't find, shadowing opportunities, find a job. And not every company is going to say, oh, you got to do 40 hours a week, especially if you're in school. If you're in school, school is the most important thing, because your higher grades, I promise you, is looked upon better in admissions than just the job itself. But EMT jobs, medical assistant, nursing, a skilled nursing facility. Again, it's not glamorous, but if you can do that and still find the joy in taking care of people, because sometimes it's wonderful to be with people, that would help you even more. Should I stop sharing the screen?
I stopped sharing it, so we have you as spotlight. So
okay.
you're looking great.
Yeah, thank you. I don't believe you, but
your tie looks great.
Okay.
So there's another question from
yes.
Kayla Connolly, and she asks, if we attend our graduate PA program in a different state, then we would like to work in the future. Is it difficult to work in another state?
No, hey, that's a really good question. So two things on that. Find a PA program that you want to go to. My wife has a friend who's a physical therapist. She grew up in New Hampshire, lived in New Hampshire, knew she was going to come back and raise her family in New Hampshire. So she went to get her DPT in Arizona. And great move. She says, I'm never going to be, young and not without kids. So went to Arizona. So find the program you want to go to. When you graduate from the program, be it Marist in New York, BU in Boston, Yale in Connecticut, you will sit for your national boards. Once you pass your national boards, we call it a PANCE, a PA National Certification Exam. You'll be nationally certified. Then whatever state you want to work in, then you apply to the state for licensure there. Most states, it's really perfunctory. They look at it and they say, aha, you graduated from a good program. You went to Emory in Atlanta, great school. You went to Emory, okay, and you have a national certification, yay. And you want to work in New Hampshire? Sure, just give us a check for, I don't know, $200, whatever it is. And they'll give you your state PA license. And there'll be certifications, the renewals, continuing medical education. But you don't get licensed by the school in the state that it's in. So get a school that you want, and then that will accept you. You take your national boards, then you sign up for the state.
Great. We have another question from Angelica Sammy. She says, right now I'm in the PA program here at Seton Hall.
Cool,
but
good for you.
Yeah, but I'm not entirely sure if I want to continue with this or go to med school and become a doctor. I'm not really sure what I want to do. Do you have any advice? Tough question.
Angelica, what year are you in? You're in your first or your second?
It's my first year.
Sandro, do you have my email? Can you, Angelica, it might be a good idea. Do you want to talk offline on this? He can forward my email to you.
Yes, I do have your email, and I'll forward it.
Do you have an email for Angelica?
I do.
Is that okay, Angelica? Because it's not a 2-minute answer. I would want to give you the respect of my full attention to that. So can we talk offline?
Yeah, that works.
Okay, all right, great. But in the meantime, just make sure your grades are up. Whatever else you do, keep your grades up in the meantime.
So Jill Patel asks, well, I am an EMT, and I was wondering if you have any advice for speaking to doctors, PAs in the hospital about shadowing them. How do you get your foot in the door? Do you know any PAs who realized PA was not for them and instead went back to medical school?
Yes, I do. Let me answer that part first. Yes, I do. There was one anesthesiologist in Manchester, New Hampshire that I worked with. He was a PA originally, and he liked it, but it wasn't for him. And he was doing it for a bit, and he said, no, I want more. And he went to medical school. Unfortunately, if you finish your PA career and you say, hey, you know what, I've been a physician assistant in pediatrics for 2 years, I think I want to be a pediatrician. unfortunately, there's no credit. You don't there's no comp test you can take and start in your second year of medical school. You got to start from the beginning. Granted, you're going to start way ahead of all of your other classmates, but you will start from the beginning. So that's why I strongly urge anybody who's thinking about either nursing, PT, PA, MD, DO, make sure you want to be in medicine. The saddest thing I ever saw was my last rotation in PA school. I was doing OBGYN, and I knew I didn't want to do OBGYN. It's like 11:30 at night. We're waiting for some baby to come out. And the fellow, the OBGYN fellow, so he's 32 years old. He's been in school for 8 years of schooling, probably 3 years of residency. Now he's a fellow. So going on 12 years of schooling. And he said, "Oh, Mike, I hate this." I said, "I know, I wish this kid came out at 4:30. He said, "No, I hate doing OBGYN. I said, "What?" He said, "I wanted to get into a surgical specialty, but I didn't get in, and I just thought this would give me enough surgery, but I don't like doing that. I don't like this." And it broke my heart. He was 32. Certainly he's going to make a ton of money and do well, but he was unhappy. And life's too short to be unhappy. And there's no amount of money that is going to make you happy. It's just not. Certainly money makes life easier, but if you don't love what you do. So the first part of that was about shadowing. Just ask. You can ask. Again, most PAs, most doctors, most nurses, therapists, they love sharing with students and tell them what it's all about and helping people. Because I mean, I was a student. I stand on the shoulders of great people who helped me along. So, but right now, there's just no shadowing opportunities. There's no place where the administration allows a shadower to come in because you take up space. You take up no itself, but useless space. You don't give anything back to the practice, and you use PPE and you crowd into a room so that you put patients at risk. So no administrator, that's how they look at it. They're not sentimental at all. No administrator will allow a shadower right now. It may change. I have a hard time even getting my students in right now. So it's just not happening. But keep trying, but just go up to them, ask them nicely. And if you're an EMT now, continue working on your presentation when you deliver patients, on your oral presentations, so that the people you're given to, the docs, the PAs, the nurses, they know what you're doing. So if you look like a good medical provider, you're more likely when the shadowing opportunities do open up to turn to you.
This is another question, and I think it also touches on the shadowing, and it looks like that's top of mind for a lot of our students.
It is.
Aiden Casio asked, at Seton Hall they offer a 3+3 PA program that makes us have 250 hours at the end of our junior year. I'm now a sophomore, so to me, time is ticking. If we don't have the time to get a job, like you suggested, would shadowing be your best recommendation for timing purpose?
No,
Okay.
No, get a job. Aiden, if you want, I can go back to the first few slides of my talk and show where I drifted aimlessly and had no clue. And I really didn't. And it was just because I didn't have a clue what I really wanted to do. Once I found what I really wanted to do, it was like a rocket ship taking off. But again, I hope I can make this as clear as possible. I watched the movie Sully, but I don't know how to land a plane. You can't learn how to take care of people by shadowing. You need to get jobs. So if you do graduate from this program and there's a PA program doesn't let you in, take that time to make yourself look more attractive. Work, and you make money too, which is the nice thing. So work, learn how to take care of patients at the bottom rung, so that you truly understand, yeah, this is what I want to do. Because if nothing else, what has shown us, a picture of my wife now having to wear spacesuits like I did in the OR, just at a regular every day because of COVID. We've lost, I think it's 1,200 healthcare providers since February because of COVID, and we're going to lose more. it's what we do. You know, we just don't go into any field in medicine just because you think, yeah, I'll do this, I'll get out and I'll make, 120,000. Hey, this guy came on, he said I can make 100 grand in Massachusetts. It's not about the money. You really need to understand that you need to make sure you do want to take care of people. Right now, shadowing is not an option. In the meantime, get a job, get your grades. So if you didn't love your grades, improve them. Work as an assistant, work as an EMT so that you get patient care experience. You may find after doing that for a year and a half, you don't even want to be in medicine at all. And that's a good thing too, so that you know before you make that commitment. Don't be like that OB/GYN fellow who at 32 realizes, I shouldn't be in this.
We're close to ending our presentation, but there is one more question from Ahmad.
Yeah.
And I think he's really focused on the ethics side of PA.
Yeah.
And he shares a great hygienist told him her friend is a PA and she's getting frustrated because the doctor she works under is always on vacation. She is a derm PA and she feels that diagnosing cancer should be above her scope. Yet she was consistently doing so. What do you think?
That's a really good question, and that happens. One of my attendings one time, who I love, we went out to dinner last week, actually. We hadn't seen each other in a while. We would work together, and she's like, I don't even check your charts anymore. And I said, it's okay. I'm not insulted if you check my work. I would appreciate it if you do check my work, have oversight. So it sounds like, Ahmad, that your friend is the dermatologist may have so much confidence in her, I think it was her, in your friend, which is flattering. But again, that's not exactly what we want. We want to be part of a team with the attending physician basically there to, as the be all, as the final arbiter. So as flattering as it is beyond the scope of some PA's practice. Now, if she's been a derm PA, she can probably diagnose it as well as any physician. But yeah, she shouldn't be put in that position because patients, when bad news comes, and I don't take this personally. Again, I've given devastating news to people. They want to hear it also from an MD or a DO. They want to get it from a surgeon. They want to hear it from the top person that, yes, this bad news is for real. There's no one that's going to come around after you, Mike, and say, no, he's wrong. This is something. So yeah, your friend is being put in a tough position, and I do not envy her. And I think it's probably just a matter of time before she would say that this isn't enough. This isn't for me. Yeah, that's not what the PAs are meant for to do. Sorry, Sandra.
That's okay. Do you have time for one more question?
I have all the time in the world. So there's just the only thing I have to do at around 8 is let the dog out. So yeah, go right ahead.
Okay. Now, I think this might be the last question.
I'll stay.
This is from a guest. I don't know who it is, but can a PA own a practice where doctors work for them, or can they only have other PAs?
So that's a really good question because something similar came just down in New Hampshire. So I'm in New Hampshire, southern New Hampshire, we're like 6 miles north of the Massachusetts border. So there was a PA who, in conjunction with a doc, bought a chain of like urgent cares. So the PA in charge was one of the business people in charge as an investor, but he could not be the ultimate medical authority. So I don't mean to confuse, but so yeah, you can be a business major, you can be a business man or a business person and own a walk-in clinic, own a radiology center as a PA, but you are not the chief medical person. You would need to get an MD or somebody else according to state law to be the chief medical officer of that. So if my friend my old attending Mary Lee and I, if we went out to dinner, and we both pooled our money and made a, MRIs are us, and that was our shop, she would still be the medical authority in that practice, even if I was the business manager.
There's another question that came up from
Yep.
Kayla Connolly, and she asked and I'm not sure the acronym PCE, and shadowing hours are going to be due at the end of the school year, and I'm short on shadowing hours due to COVID. Are virtual shadowing hours being accepted due to the pandemic?
I don't know. First, what's PCE? Is that, are you in a program right now?
Yeah, I'm in the 3+3 program at Seton Hall. I'm a junior, so they're like the patient contact hours. They want, the school wants 250, and I got like all of those through being an EMT, but they also want like 30 shadowing hours.
Yeah.
And I'm short on those because the PA that I shadowed last summer works in a hospital, and they're obviously not letting people back in. So
Right.
I've seen a couple PAs doing like a virtual session where you log onto a call kind of like this. They go through a presentation, talk about their day, and then you get like a certificate of completion after. So I wasn't sure if you had seen any of that popping up in applications that you've been looking over, because I know that's probably an issue that a lot of people are having.
It is. Kayla, can you come back on? So in the 3+3, just can you explain it to me? So you go into Seton Hall as an undergrad in some kind of medical major, and then at the end of your third year, if you're accepted into their PA program, you transition to the PA program in your what would be an undergrad senior year. Is that how it works?
Yeah, so you apply into it out of high school, so you get accepted. So my undergrad is going to be in biology. So next semester is my last semester of undergrad, and then your fourth year, you go to the graduate portion, and we're partnered with, I think, Hackensack Medical. So we go to the medical campus our fourth year and start the didactic.
Great.
So,
And then at the end of your first year of PA school, basically, you get your undergrad in biology. And good. Okay, so that's not an uncommon thing at all. So in Mass College of Pharmacy, MCPHS had a very similar program. So let me tell you, as one of the guys who does the admissions for BU, ever since the world ended in March, that's how I say it, everything is so different. One of the things we had to do at Marist, what I did was I created a telemedicine course. I mean, literally, people across the country in PA programs and medical schools as well. The medical schools were graduating people ahead of time from the 4-year undergrad into their residency. So they were, everyone was scrambling. Everyone was doing stuff. So one of the things we did was create a telemedicine course where you would do something like this, and you would interview people over the via Zoom or WebEx or however we did it. I prefer Zoom. And one of the things is that is not even the future. That's now the present. So a lot of the meetings we're going to have with people, a lot of the encounters can be done via telemedicine. And we know this. So if you were applying to me and I look at and it's Kayla Connolly, and I say, aha, Kayla Connolly, Seton Hall, hey, my son goes to Seton Hall. Let me take a look at her application. And I see that you did, first of all, you're an EMT, so I'm like, good, you know actually what it really is like, taking care of people. And you did the simulated, encounter shadowing hours. For me, yeah, sure, that is absolutely fine with me. Again, you know how I feel about shadowing anyway. I think it's more important that you're an EMT and your grades are high and your GRE is good. But yeah, if there were virtual shadowing hours, you still had to you still had to talk with a real patient or a fake patient. We use standardized patients here at BU. Actors who act like patients, and they do a great job. So yeah, you still did that. So absolutely, that would count for me. And I think for almost all of my colleagues, they would say the same thing. Yeah, that still counts as shadowing.
okay, thank you.
You're welcome. And good luck. Good luck, man.
I think Professor Smith, that was the last question of our session.
Okay.
Thank you so much. Yeah, I don't know if you want to share some
I
final
did.
thoughts?
If we do have 5 minutes left, you know what? I'll just touch on Angelica's question about. I'll talk in general, Angelica. I still do want to talk online, but in general, I would say to anybody, if you find yourself in a program and you're not sure you want to be in it anymore, keep your grades up. Number one, keep your grades up, and talk to the program director and your trust and whoever you trust as a faculty. Don't just tell everybody. Don't tell your classmates, but talk to the faculty. Talk to the program director. Ask them what they think about what's going on. There was a gentleman about 3 years ago at MC when I was still at MCP in Boston, and in his second year, he realized, and I joke, it was probably my class that did it to him, but I had a class called Diagnostic Methods, where I taught them all about laboratory work and how to read X-rays and CTs and all this stuff. And he realized he didn't want to be a PA anymore, and he actually transitioned into the imaging department, particularly into MRI. So MCP was fortunate. There was still so many different science majors, and it's it's like a medical arts school. He could transfer into something else because he realized, yeah, being a PA is not exactly what I wanted to be. So if any of you're doing something, you're a biology major, you're a chem major, and you say, you know what, I don't know, I want to do this. Talk to your advisors and think about it. And if you need to, you can take time off. My career path, I know my title sounds awesome, and I really am humbled where I am. But again, I was 27 years old before I knew what I was going to do. And there's no deadline. It wasn't like someone said to me, nope, sorry, Smith, 27, you're stuck. You can't go to school, because you can do anything. It would be better if you reassessed right now what you're doing, even if you need to take a semester, take a year off now, rather than go into something and you're not sure of, and then you find out 5 years from now, you just hate it. So in the meantime, take care of business, but talk to people that you trust, and look at other options too. Go to other fairs. If there's something, Angelica, if you think about medical school, look at medical schools, and anyone else out there that I could just build. If you're thinking about you want to be in imaging, look at it. Maybe that's the thing. I can tell you that the gentleman who switched and went to the imaging department was so much happier, and you could just tell, you could see it. It's what he liked better. And I'm not just a PA professor. I'm a faculty member. And again, I was fortunate enough to meet some great people who brought me along. And a lot of people, like my colleagues, feel the same. We would rather help a student find out what truly is their calling than just continue to promote PA students. So of course we do, but I hope that answers. But yeah, I'll touch. So thanks for giving me the extra couple of minutes there, Mr. Tejada.
Oh, of course, you deserved it. You were awesome, and you see some of the wonderful notes shared by our students. Thanking you for your time. Answered some wonderful questions, answered their questions, and it was extremely helpful. And again, thank you for participating in this speaker series to share, how you got there. And I think you shared a wonderful story on how, it's not always a straight path to what you want to be. And so there'll be some twists and turns during your time once you graduate from college. But it seems like, from your story and your life, that persistence and knowing that, opportunities will come up, that, things will happen for you. So thank you so much for sharing. And we're excited that we could share this recorded session with those that weren't unable to attend, because I think they'll get a lot from this. And thank you. And we really appreciate your time and your talents.
Thank you. Thank you very much for inviting me in the first place. And if any students ask, please feel free to give them my the best email. The better email is the one at BU.
Okay.
At BU, because that way I go right to there. I check that every day.
Perfect.
And
yeah.
Thank you very much, and thank you all for the wonderful questions. I really appreciate it. And feel free, if I can help anybody make a decision, I'm more than happy to.
I was told that I need to plug some of our events that are going on tomorrow. So I
Yes,
have to
please.
do that just to make sure everyone also attends. So yeah, tomorrow, Wednesday, October 28th at 1 p.m., which will continue Seton Hall Week, we have what's called Pirates Beyond Play, the history of Setonia athletics. I think, Michael, if you want to learn a little bit more about Seton Hall sports, that starts at 1 p.m.
Yeah.
And then, yeah,
Can I have access to those? Really? I can join
yeah,
in?
I'll show you. Yeah, I'll send you the link to that session and those that are occurring tomorrow. And then at 5 p.m., we have a back to school class with Dr. Kelly Harris, who's the chair of our Africana Studies. And he'll have an informative presentation on the Montgomery bus boycott with special attention to Rosa Parks and the numerous grassroots organizations that were critical to the success of the boycott. And that should be exciting as well. And at 6 p.m., we have another How I Got Here discussion with Seton Hall parents. We have a tag team, and you should have had your wife participate with you. We'll get her next time. Seton Hall parents Nora and Phil Polk. Nora is a judge at DeKalb County Magistrate Court, and Phil is an executive level marketing leader. So that should be interesting tomorrow. And then we'll finish up at 7 p.m. and it's a back to school class with Dr. Inez Musaku, who's the professor of religion and director of Catholic Studies program, and she'll be sharing one of our study abroad programs that she oversees, and it's called Italy in the Footsteps of the Saints. So that should be interesting. So I just wanted to share that with everyone, and we hope to see everyone tomorrow as we continue Seton Hall Week. And again, thank you, Professor Smith, and I look forward to speaking with you and engaging you in the future as I have you for the next 4 years, I think, right?
At least.
At least
It should only be 3.
3. Okay. All right, good.
Unless he decides to go to grad school there as well.
We hope that's the case. But thank you again and have a great evening. Say hello to your wife for me.
I will. Thank you.
Be safe and take care.
Thank you very much. Good night, everybody. Thank you.